And we are taking you to breaking news now. Governor Andrew Cuomo is set to deliver another update on the ongoing coronavirus outbreak. He is in Albany right now. Let's take a listen in.
Protocols that we are following, and hopefully there'll be clarity across the board. Where we have organized in an emergency management system response capacity. When you have a statewide situation that requires immediate government action and coordination among different agencies with local governments, that's our emergency management system protocol. We have a New York State task force that has been working on this, which has obviously been interagency. These are the members of it. Some of them are here with us today. You see who's on it, who's not. Rob Mahika is not on it. He's been focusing on the budget. Three basic areas that we have been operating on: the testing priorities, quarantine, and containment tracking. And we'll go through them quickly. On testing priorities, first priority for testing is people who have been in close contact. We define close contact as within 6 feet of a person who is known to be positive. Second, people who have traveled to a country with level 2 or 3 travel health notice from the CDC and is experiencing symptoms. Third is a person who's in quarantine and has developed symptoms while in quarantine. Fourth, a seriously ill individual who has not tested positive for other viruses. So when the person has gone into the hospital, they run the viral screen, doesn't test positive for any other viruses, then test for the coronavirus. Fifth, any other case in which, in the opinion of the healthcare professional and the local health department, they believe requires testing. So they would call up and consult with Department of Health on that one. Quarantine, there's two types of quarantine. We keep going back and forth between the word quarantine and isolation. Let's say they're basically synonyms, but isolation is the technical word. So it's really mandatory or directed versus what we call precautionary. Mandatory quarantine: anyone who tests positive, anyone who has been in direct contact with a person who's tested positive, anyone who's returned from a country CDC level 2 or 3 and is experiencing symptoms, any other person who their health professional and the local health department believes needs to be quarantined, and they'll speak to DOH to make that determination. That's mandatory quarantine. Precautionary quarantine: you return from a country with CDC level 2 or 3, but you are not symptomatic, okay? That's precautionary quarantine. Proximate to a person who is positive. Proximate, not direct. Direct is within 6 feet. Proximate exposure is, I was in a car with a person, I was in the office with a person, et cetera. Third, any person who the local health provider and the local health department thinks should be quarantined, and again, they'll consult with New York State Department of Health on that. The last system that is operating is containment tracking. We're mapping all these cases, we're analyzing them, we're investigating them. Every time you get a positive, you run that case back to see who else could have been infected, and we are communicating that. The number of precautionary quarantines is at 4,000 statewide. You can see the list there. It's basically all across the state. Obviously heavier in New York City and in Westchester. 2,700 New York City, 1,000 Westchester, and then 115 Erie, 70 Nassau, Tompkins 15, Suffolk 15, Albany 11, Broome 4, and you can go right down the list. Schenectady 12, Warren 6. Mandatory quarantines, 4 statewide, New York City 9, Westchester 33, Erie 1, Nassau 1. In terms of new cases, yesterday we had 22 cases. Today we have 33 cases, so it has gone up by 11. There is one new case in New York City. That is a case where a person is tested positive. It is connected to the Westchester case. 3 members of the Young Israel congregation connected to the Westchester case. All of the new cases are connected to the Westchester case. 2 friends, 2 people in Rockland County who worked at the bar mitzvah, and 3 patients, 3 people connected to the visit at the Lawrence Hospital. That brings, those are 11 new cases. 22 goes to 33. Just a general context question. The number will continue to go up. I've said every day the number will continue to go up. The number must continue to go up because it is mathematics. The more you test, the more positives you will find. And remember, we're predominantly testing people who have a higher probability because they're in the chain of contact with a person who has already tested positive. So people see the number go up, so the number is going up. The number has to go up. The number can't go down, and the number has to go up because we are testing people, because we want to find people who are testing positive. That's how you contain it. Find the person who is infected, quarantine them, and reduce the infection rate. That's what it's all about. Also, some of the news stories sum up what I have been saying. Say, Cuomo urges calm. I'm not urging calm. I'm urging reality. I'm urging a factual response as opposed to an emotional response. I'm urging that people understand the information and not the hype. We have more people in this country dying from the flu than we have dying from coronavirus. All the experts say 80% will self-resolve, 20% may get ill, may require hospitalization, and it's most problematic for senior citizens, people with immune-compromised situations, and people with an underlying illness. The fact of our own experience, okay, I don't believe anyone, okay. The fact of our own experience, we have 33 cases. 5 of the 33 are hospitalized. 5 of the 33. That's about 15%. Verifies the about 20% may be hospitalized. Of the people who have been hospitalized, they are improving, right? So those are the facts. What are we concerned about? Senior citizens in congregate facilities, people with compromised immune systems. Those are the populations we have to most protect, which are also the populations that are most affected by the normal flu. That's why I go back to what I said to my mother. This is like a flu on steroids. You catch it the same way, you target a population who's most vulnerable is the same, take the precautions. Dr. Zerk, every flu season, says to me, you should tell people don't shake hands and don't. Why? Because that's how you communicate. Sanitizer. So it's the same precautions, it's the same issue. Look at the facts. Look at the facts. I know this is a great issue on all the TV stations. Anybody has an opinion. Look at the facts. If you look at the facts, facts dictate calm. Of course,
how many tests has the state actually performed at the point? I know, Doc, you said the past was about 100 a day. What's the total number we've done?
I have to give you the exact number. I'll give you the exact number.
An estimate? Are we talking 1,000?
We've done dozens of tests.
More than let him give you the exact number.
The exposure to Rochelle, obviously, these cases continue to go back to the folks in Rochelle. It seems like there's a doctor who is one of them. I know you don't want to get into specifics about people, but there seems like there's a doctor. Can you talk at all really about the exposure in that case, and whether there's concerns that this doctor might have treated patients who are, then that leads to a whole other set of questions?
Well, I think the way to look at this is, as we've been saying, it's community spread. So you can deal with a community that deals with a school, or whether it deals with an office, or it deals with a family. And so, not to get into specifics, this is we go back and we track this to try to find out how close was someone, how far away were they, are they somebody we need to follow up and test further.
Yes, what do you do at Metro North, right? I mean, we know the lawyer, the first one, he traveled on Metro North. How do you start, what do you start going back and see what train that person was on? They were on the 840 train from New Rochelle to, Grand Central Station, stuff like that?
Well, a couple of points here, Joe. First, remember, we are learning more, we're more educated. So healthcare professionals, for example, doctors, nurses, et cetera, they're in a different situation they're in a different situation today than they were 10 days ago or 2 weeks ago. And nobody thought to think about this when somebody walked into the office. So now fully informed. Second, you test and track every lead you get. That's basically what you do. And we're looking for positive results because that means we have identified a person that can protect other people from the infection. The lesson to me on New Rochelle is how you can, in a gathering, a number of people can get affected, just like flu, by the way. You can have one large gathering, 400, 500 people in a gathering, and you can affect a number of people. So for senior citizens, if you are immunocompromised, I think you should take precautions and be cautious about going to a gathering. For everyone else, you get the flu. You get coronavirus. And it's the result is 80% is going to self-resolve if you're not senior citizen, if you're not immunocompromised. On the back,
player who might have that's
And we were just listening to Governor Cuomo taking questions from reporters in Albany. We were just having some problems there with our audio. So we'll update you on the latest number of the coronavirus outbreak. Those numbers of confirmed cases in New York State is now 33 and is expected to climb. Governor Cuomo says 5 of those people are hospitalized, but he says they are improving. So here's a breakdown now of some of those numbers. There are 18 in Westchester, 5 in New York City, 1 in Nassau County, and 2 now in New Jersey. And there are 4,000 precautionary quarantines in the state. Governor Cuomo says officials are prioritizing testing for anyone who has been in close contact with a person who has a confirmed case of coronavirus. New York State health officials say the best way to contain the coronavirus is to interview all of the newest patients and then to test everyone that they have recently been in contact with. But local and federal officials say right now they do not have the resources to do that. Now, we will continue to bring you the very latest on this story here on CBSN New York and CBSNewYork.com.